Right. Which of the following is most likely underlying cause of this patient's condition? Let's see here. 12-year-old boy presents to the clinic with 6-month recurrent history of dysphagia, particularly solid foods, intermittent chest pain, denies any fever, weight loss, vomiting. His parents have noticed that he had food impaction on multiple occasions. Boy has atopic derm. His mother has asthma. Physical examinations are remarkable. Upper endoscopy, reveals multiple white plaques and rings through the esophagus. All right. Eosinophils. Okay. Um, hmm. See, I like esophageal candida.
Okay.
However, something else with eosinophils is bothering me because I know there's something else that screams eosinophils with rings. Um, White plaques is always good for candida. However, within the esophagus, and I just did this the other day too, there's a few different, it's not GERD, it's not immune dysregulation. There's something with, I know, esophagus and eosinophils, which doesn't really fit candida. Could just be like an infectious esophagitis. Scleroderma, let's see, is there anything of scleroderma? Not really. I mean, with the with the boy having atopic derm, his mother having asthma also helps for esophageal candida. Um, Although he's not denies any fever, weight loss, and vomiting, he's not like immunosuppressed. That's where you really see esophageal candida. It's like a AIDS-defined disease. Let's see. Multiple white plaques and rings. I always thought the like eosinophilic esophagitis. Hmm.
So I think you're good on your diagnosis there. I would probably say that fits that the best here, but they don't have that here. So what are you gonna pick if they don't have that here?
Maybe, I mean, I don't have a, it might just been the infectious esophagitis. It's been a long time. I think this is one of the ones where I would go against that initial thought. But although I'm looking to see like, are they trying to trick me here? It's like what multiple white plaques. I hate going away from candida with
Okay.
that. Um, like white plaques in the mouth, I think of either the ones caused by EBV or or candida, but that's more of the mouth. Um,
All right. You want to keep with esophageal candidiasis?
I mean, I know that I like eosinophilic. I mean, that's a big thing. Increase in eosinophils. That doesn't make sense for candida. That's my only thing. Like that, I usually get stuck in questions like this. I'm like, okay, some of this stuff lines up with candida, but then there's something else where it's like pulling me away, and I'm thinking like infectious esophagitis.
Okay. So you got to pick one. Is it enough information to switch your answer? Remember, you got to be 100% sure to switch.
Dysphagia, particularly solid foods, recurrent episodes, chest pain. Yeah, I would switch. I think I would switch.
Okay.
Food
Fine.
impaction. Yeah, because I don't think with candida you're gonna have food impaction. Yeah.
Okay.
Oh, it's wrong.
So
Immune
so
dysregulation. Okay.
So interesting, right? So the
Yep.
way they phrased it is right. The way they phrased it is immune dysregulation, right? Meaning that it is eosinophilic esophagitis.
Hmm.
Okay, so which is in a sense an autoimmune disorder, aka they
Oh,
rephrased
okay.
it as an immune mediated disorder. Okay,
Makes sense. It makes sense.
so esophageal candidiasis, right? It can cause white plaques. However, like it's more immunocompromised, and it's not
Hmm.
with eosinophils, like you said, right?
Hmm.
GERD, right, definitely doesn't fit GERD, right?
Nope.
Infectious esophagitis, right? Chest pain, but usually has fever and other symptoms, right?
Yeah,
So,
and it's also been a long time now that I think
yep,
about it.
it's
It's like
six
you're not going to
months,
have
right?
that infection for 6 months like
Yeah,
that.
exactly. Exactly. So best answer definitely for sure is that
Ah,
EOE. So finding an answer choice, that's why it's so key, right?
okay.
Finding an answer choice that fits that EOE, right? Because the eosinophils, the dysphagia, the atopy, right? Mom's history of asthma, it all fits eosinophilic esophagitis, right? So
Mhm.
trying to find an answer choice that fits that, because sometimes they'll kind of switch it up on you and tell you a way that you're not used to.
Okay.
All right.